So the amount of antenatal visits that a woman usually has would depend on what health issues, if any, she has, whether she's a healthy woman with a healthy pregnancy or whether she is having some additional checks because of other health issues. However, a woman who is doing combined care will have every second visit with her GP, and this usually would amount to at least 6 visits in Rotunda Hospital and alternating with her GP thereafter. So a couple of differences in antenatal care in the Rotunda. We usually would recommend combined care, which is the GP for half of your visits and also Rotunda for the alternating half of the visits. With midwife led care, it means you are seeing the GP and the midwife in Rotunda every second visit. The midwife is an expert in normal pregnancy, so she would be perfect to look after you if you are a healthy, low-risk woman experiencing a healthy, low-risk pregnancy. In regards to midwife-led care, there is a couple of options, and these options would be seeing the midwife here in Rotunda, or you could see one of our community midwife team we have lots of different clinics in all the north side of Dublin, so providing you're within their catchment area and low risk, they would be perfect to look after you during the pregnancy and also after when you have your baby. The midwife is an expert in normal pregnancy, and she would always assess you and your pregnancy to see if you're developing any risk factors and refer you back to the obstetrician. The obstetric led care, then we have a couple of different options in the Rotunda as well. So you can come to our public clinic and see one of your team doctors at every visit in Rotunda, or you can choose to go semi-private or private in the clinics here in the Rotunda as well, where you'll be seeing an obstetrician for each visit. What options of care you would have, you may think about before you have your first visit in the hospital, and it can be discussed with one of the midwives or the doctors or perhaps your GP. If you're going to go private or semi-private, it's a really good idea to check with your health insurance provider to make sure what cover you're entitled to, which may aid your decision.